The importance of the disclosure of adverse events to patients and their families must not be minimized. The Children's Hospital's Solutions for Patient Safety Network recommends a standardized disclosure process and training tools to help prepare clinicians for these difficult conversations. This is greatly needed because clinicians are required to have disclosure conversations yet are not trained. This forces them to essentially learn and practice disclosure in front of distressed families. Clinicians sometimes aren't sure what is okay or not okay to say. In our scenario, a 4-year-old male named Alec Romero was admitted to the pediatric intensive care unit following a traumatic brain injury after falling off a play set at the park. On admission to the PICU, the patient had a PICC line placed. On day 3 in the PICU, the attending received a call from the radiologist that a retained guide wire was noted for the first time on that morning's chest X-ray. Radiology did not have an explanation as to why this was not noted on previous films. The PICU attending called the physician that placed the line to inquire about the insertion. The physician stated that the insertion had gone smoothly, but that she was interrupted with an emergency page towards the end of the procedure and was distracted. She also stated that she felt very rushed as the unit was extremely busy. The patient will need to go to the operating room under general anesthesia for removal of the guide wire. The patient has not experienced any apparent harm from the retained guide wire. However, he will require an intervention for retrieval of the wire. Before we see a demonstration of the recommended process for the disclosure of adverse events, let's take a look at how a disclosure conversation might go without the proper training. It is important to note that clinicians enter into these conversations with the best of intentions. The following scene has been exaggerated to demonstrate an ineffective disclosure conversation.
Hey, Mom and Dad, I just wanted to call you in here to let you know that I got a phone call from the radiologist this morning. They were looking at the chest x-ray that the patient had, and they found that there's a wire left in Alex's arm, and we're going to have to go in and take it out.
My son's name is Alec.
Oh, yeah, Alex, sorry, whatever. I mean,
I'm sorry.
It's just we're really busy. But
What do you mean you left a wire in his arm?
So, sorry, we're just so busy. Anyway, yeah, we use a wire to place PICC lines, and so unfortunately it just got left in his arm, and yeah, he's going to have to go have surgery to have it removed.
What do you mean he's going to have surgery? This has been so awful these last few days.
He's doing okay. He's fine. It's just that we're going to have to get the wire out.
When are you going to take it out, and how long is that going to take?
So I don't know yet. Well, it's once we get the procedure scheduled, it'll be really fast.
Help me understand what that means.
I just think that right now you guys need to focus on Alec is doing fine, and we're going to get the wire out, okay?
But how is it in there? Why is it in there?
I don't know. I mean, somebody else made that mistake.
I don't feel like you care about what just happened to our son.
This is really frustrating. I don't understand any of this. I feel like we need a second opinion. Or we need to call a lawyer.
You don't need a second opinion. We just need to focus right now on getting the wire out of Alex's arm. That's the main thing, okay? Thanks for your time.
Unbelievable. What is going on?
Oh my gosh.
The Children's Hospital's Solutions for Patient Safety Network recommends a standardized disclosure process and the use of training tools to help prepare clinicians for these difficult conversations. The next video will demonstrate the process recommended by SPS and can be used as a training tool. The adverse event disclosure process includes a disclosure huddle to prepare for the conversation and gather facts, a disclosure conversation with the patient and family, a debriefing, and lastly, documentation of the disclosure conversation in the EMR. This video will show each of these steps using the tools recommended by the SPS network. It is important to note that hospitals should consider how they support staff members involved in these events. However, this is not addressed in this video. Prior to meeting with the patient and family to disclose the event, it is recommended that a huddle take place to verify the facts surrounding the event, gather patient information, and to anticipate any questions the family might ask during the disclosure conversation. This also provides an opportunity to validate that the person who is planning to serve as the disclosure spokesperson is capable of doing so. During the huddle, a disclosure coach can provide helpful tips on what to say and what to avoid saying when disclosing.
Kim, thank you so much for meeting with us today to get ready to talk about this event with the family. I've been taking care of this boy for about 2 days now, and I just feel so terrible that this happened.
Absolutely. That's why we have these resources. We can go through the disclosure worksheet together. Does that sound okay? Thanks so much for being here, Dan. As we prepare to go talk to the family, the worksheet is really helpful, and we can start with the huddle section and make sure we have all the information we need before we go in and talk with the family.
Okay.
So when did the event happen?
It happened on Saturday when he was getting his PICC line placed.
Okay. And when was the event recognized and by whom?
The radiologist first noted it this morning when he was looking at the chest x-ray. He saw that the wire had been retained in his arm.
Okay. So where did the event occur?
That was in the PICU, is where it was placed.
Okay. Are the parents aware of the event?
No, not at this time.
Were they present?
No, due to it being a sterile procedure, we had them out in the waiting room.
Okay. Do we anticipate any family support needs?
I don't think so.
Okay. So what don't we know about this event?
Well, we don't know why the event even happened. We also don't know when we're going to be able to get him the procedure to get it removed. So we're trying to find time in the OR schedule for him, and we just want to make sure his labs are okay and that he's stable to go down and get that procedure done.
Okay. And also, before we go in to meet with the family, what other questions do you anticipate the family asking?
I would anticipate them asking about the risk or complications related to this procedure. They'd probably want to know who was all involved. And then probably most importantly, how can we prevent this in the future?
And we will do a full review of the event. I've asked Mr. and Mrs. Romero to meet with us in about 30 minutes in the family conference room so we could disclose this event to them.
Okay. Do you feel comfortable going in there and talking to the family?
Yeah, I do. I feel like I know them really well, so I'm
Okay.
comfortable talking to them.
Do you want to review at all or practice before you go in?
I don't know if I need to practice, but Dan, I would like it if you could come with me to do the disclosure.
Absolutely.
Okay. Well, I think that we're ready then, and I'll stay on the unit so that I can help with the debriefing after the conversation.
Okay, that sounds great. Thank
Perfect.
you.
After the huddle, the actual disclosure conversation takes place to inform the patient and family of the fact that an event occurred and the next steps. During the disclosure conversation, it is important to express empathy. Empathy is not an admission of fault. Empathy can be expressed using statements such as, "We are sorry this happened," or "We feel terrible that this happened to Alec." Be sure to review your state's laws.
Mr. and Mrs. Romero, thank you so much for meeting with us today. As you know, I'm Allie Miller. I'm one of the PICU physicians taking care of Alec, and this is Dan Smith. He's our nursing manager for the PICU.
Hi, Dan.
We met earlier today.
So sorry to pull you away from Alec, but I did want to talk with you. The radiologist called me this morning, and he was reviewing the chest x-ray that Alec had done, and he noticed that in Alec's right arm where the PICC line is placed, there's a wire that we use to place the PICC line, and unfortunately that wire was left in place. And he's going to have a procedure to have that wire taken out. And we are so sorry that this has happened.
I'm really confused. The PICC line was placed 2 days ago. Why has it taken this long to see it on x-ray?
Yeah, unfortunately I don't have the answer to that right now. But we are going to do a full investigation of this whole event and see if we can find out what happened. And as soon as I learn more information, I'll share it with you. Alec is safe right now. He's doing okay, but he will have to have a surgery with anesthesia to get the wire removed today.
He's got to go back under.
Unfortunately,
After everything he's been through, he's suffered so much. And because you made a mistake?
I'm so sorry. And we are looking into this. I can't even imagine how scary and stressful this must be for you. As soon as we know more, we'll let you know.
So when will he go to get this taken out, and how long will it take?
We don't have an exact time for him yet, but it will be sometime today. And when I know more of the specific time, I'll let you know, okay? The procedure itself takes about 30 minutes, so it's not long, and they'll take the wire out, and then he'll come back up here to the PICU. As far as his safety for going down to the operation, I want to review all his labs and make sure that he's safe to get anesthesia again before he goes down. So I'm sure you guys have a lot of questions floating around in your head right now. Is there anything I can answer for you?
I'm sorry, I'm trying to take this in. It's very overwhelming. It's been really hard these last few days. I don't know that I have any immediate questions, but do you?
This is just really frustrating. We're both really upset, but we do appreciate your honesty and taking the time to talk with us.
I do want to make sure that you know we'll have lots of opportunities to continue to explore questions you might have. So I'm here all day until 7. I'm here all day tomorrow. And if there's anything that comes up in the meantime, I did have Dan write down his phone number as well as all the charge nurse phone numbers. So if anything comes up, you can certainly just give us a call and let us know. And otherwise, I'll check in with you guys tomorrow. Again, just so sorry that this has happened, and I can't even imagine, but we are going to take good care of Alec and keep him safe, okay?
Thank you very much for telling us.
After the disclosure conversation occurs, debriefing is recommended. The debriefing is then followed up with documentation of the conversation in the medical record.
As a follow-up to the disclosure conversation, I'd like to complete the debriefing section of the disclosure worksheet.
Okay.
What were your general impressions?
I thought it actually went really well as could be expected. I mean, Mom and Dad were upset, but I think it was pretty good.
I think Dr. Miller did a great job expressing how sorry she was. I really feel Mom and Dad connected with that well.
Thanks.
Okay. What do you think were some opportunities for improvement?
Well, I really wish that I'd had an exact operating room time for them. Then they could have had more of a plan moving forward.
I agree.
Okay. So what would be next steps for family?
Well, I will be following up with radiology, finding out more about what happened. I do think this event deserves cause analysis. And then we'll get him on the schedule for the OR today.
I'm going to go ahead and call pastoral care. I thought with how upset Mom was, she could really benefit from that.
Good idea.
I feel that we should make sure we document the conversation in the medical record and complete that variance report.
And I can do that documentation.
Excellent. Good work.
Thanks.
Thank you.
Documentation requirements are organization specific. Be sure to align your practices with your organization's policies and procedures. You are now equipped to have an effective disclosure conversation with your patients and families. Remember to incorporate these steps shared today so that you are well prepared to have these difficult conversations. This training can be found in the Disclosure Manual to help prepare clinicians for disclosure conversations. The Children's Hospital's Solutions for Patient Safety Network recommends the use of this standardized format to enhance the disclosure of adverse events.